go over dry needling, one of the therapies we use in our office. So for this patient, we've already evaluated her. Maybe go ahead and just flex your calf here, so point the toe. So we're going to be working on the gastrocnemius, which are these two muscles right here. Go ahead and relax again for me. Thank you. So the needles that we're using they're dry needles, but they're essentially acupuncture needles. So they're very thin needles that were put directly into the muscle. The purpose of this is to relieve any trigger points or areas of tight, spastic muscle. And so what will happen when those muscles are tight, they get less blood flow, and that's what creates a lot of pain and discomfort. So on this medial part of her gastroc, you'll be feeling for a trigger point. Got one right here. So it's going to be a quick tap, and it's in. That's generally the only thing a patient's going to feel is just a really quick pinch, and we're just going to slide it into the muscle belly itself and relax. So most of the time people don't feel anything, maybe a little twitch of the muscle, but what this is going to do is make that trigger point relax. And so we leave it in for about 10 minutes, restores blood flow, lets the muscle relax. And this is something that really accelerates the healing process and the decrease of pain in people who have really tight muscles. So we use it in the calf, we use it in the Achilles, plantar fascia, patellar tendonitis, basically any muscular skeletal syndrome where people are going to have trigger points in particular muscles, commonly rotator cuff stuff, trap, upper back, neck, and we found it's quite effective as well for headache. So any cervicogenic headache where the pain is coming from the neck or tight muscles around the skull, dry needling is extremely effective. So it goes great with chiropractic care. We're talking about the spine and nervous system, and great. There we go, a little twitch there. And I'll push it the rest so we don't feel anything else there. Awesome. And so we can work right around the gastroc. This is now that lateral gastroc muscle here. Another little twitch there. And we also have, so in a case of someone who's got more stuff going on the lower leg in general, there's also the soleus, which is a flat muscle underneath this big bulgy one. So we can come right here, or use a deeper needle, but for demonstration purposes, just right here. Go right here. And so people who have Achilles issues, we try to get both muscles because they both make up the Achilles. And it's that simple. We just leave it in for about 10 minutes. When we come back, the patient doesn't feel anything during those 10 minutes. They just relax, play on their phone, take a nap, whatever.